This video is about a breast lift with an implant, so Mastopexy augmentation. So why would we do an augmentation? Obviously for size, but we also need an implant. If somebody has a real kind of ski jump upper pull, as we call it, or upper half of the breast, we unfortunately haven't been able to figure out how to take hanging breast tissue and move it into the upper half. We can take the hanging breast tissue and move it into the central part of the breast, but when somebody wants a rounder, more fullness in the upper half of the breast, we need an implant. So it may not make a lot of sense to you, but what we have to do is add an implant to the top half and take out some of the sagging bottom part. So with a breast lift only, we can move that sagging bottom part, but with a breast lift and an implant, we can't, and it's all about blood supply because the implant interferes with the blood supply to that lower half. So with a breast lift and an implant combined, we take out the hanging bottom part and compensate by adding a slightly larger implant. So if somebody wants a breast lift with an implant for the fullness and wants to stay the same size, then we'll match what we take out to the size of the implant. When somebody wants a breast lift and a larger size, we compensate with a slightly larger implant for the amount that we take out below. So breast lift with an implant, we can go above or below the muscle. So you do need to watch the breast augmentation video. But the breast lift with the implant results in the lollipop scars. I don't do the lollipop and the anchor scar. That big scar along where the underwire sits is not necessary. So you get a lollipop scar, 15% chance of losing sensation in the nipples and breast skin, which you can reverse that statistic and say that 85% of patients will recover normal to near normal sensation. Breastfeeding potential is about 50-50. And the risk with a breast lift, whether it's with or without an implant, the main thing that I worry about, infections usually easily treated with antibiotics, any excess bleeding. You don't bleed much with the surgery, but sometimes there might be bleeding back into the pocket. But those are all things that are easily taken care of. The one that I really worry about is circulation to the nipples. So we want to do everything we can. I don't remove the nipple, I move it, but I want to make sure I preserve that blood supply. How often does it happen that we run into circulation problems? It's about 1 in 400 patients, but you do need to know that that potential risk is out there. So recovery with the breast lift and an implant is usually pretty straightforward, not much different from the implant itself, not much different from the breast lift, slightly longer if it's under the muscle. The problem with a breast lift and an implant is the weight of the implant is going to drag things down a bit. So the larger the implant, the more recurrent sagging will occur with the implant and the lift. So with a lot of patients, a lift with a relatively small implant just to give upper pull fullness has a pretty good long-lasting effect. But the larger the implant, the more things are going to drop back down again. So if you're considering breast implant surgery, check out the website for a lot of different patient examples or call the office and they can send you a copy of our handout.